So the answer to the overall question of how can developments in artificial intelligence bring advancements to medicine, we need to first obtain a general grasp on what AI is. So, artificial intelligence is described as the use of computers and different technologies to simulate intelligent behavior and critical thinking by a capacity given by humans to machines to think, create, make decisions, etc. Understanding this as a basic concept is very important to this idea and gives you a good foundation to the possibilities of AI in medicine. The basic idea of AI is the use of new techniques that may be able to find new chemical spaces that chemist bias might prevent. This is because models of artificial intelligence can be built with little prior knowledge or rules of the general practices of chemistry, allowing new foundings to be easier to get to possibly. This ties in to general chemistry and gives us a start as to how artificial intelligence is important in this field and class because of the discussion around atomic combinations, studies of drugs, and reaching new lengths that chemists might not even believe possible because of the constrictions in their field or even their mind. Artificial intelligence is being used every day as we speak in simple ways that we may not even understand. This includes online scheduling of appointments, online check-ins, digitization of medical records, reminder calls, and understanding multi-drug combination risks, which really ties in directly with the practices of chemistry and pharmaceuticals because of the risks of doing this and combinations of multi-drugs which could result in death. So we often see this and may not even realize that they are forms of artificial intelligence. Artificial intelligence in medicine has a variety of different tasks that have continued to be discovered and perfected by many different schools and hospitals. The major section of this being focused on is clinical support and imaging analysis. So there is a virtual and physical section to the uses of AI. In medical imaging, AI tools can be often used in radiology for a variety of different reasons. They can analyze CT scans, X-rays, MRIs, and other things that human radiologists might miss. This has occurred with me, where a doctor missed a stress fracture, and this explained why I wasn't really healing correctly and feeling the amount of pain I did. So this is really recent and important to me. Some other different uses of AI include disease detection and treatment, again, which can be accurately made with AI over humans in many different facets, just based on lack of knowledge and so many different possible outcomes. This also includes personalized disease treatment, medical imaging, calculations of clinical trial efficiency, and so much more. All of this really just goes into the depths of artificial intelligence that can be made and used to help expand the medical field. This has many benefits, such as more better informed patient care, error reduction, reducing costs of care, increasing doctor engagement, and providing contextual relevance. With the vast amount of knowledge available with artificial intelligence, answers can be found quicker, more accurate, and allow doctors to spend more time with human patients and ease nerves, answer questions, etc. The physical part of AI that I talked about previously, that goes hand in hand with the virtual part, can be very expensive, but can lead to more accurate and precision in incisions and cuts in surgery. This allows for a nice 3D view and magnification options that would not be possible with a surgeon hand. This technology can mimic movements of a surgeon, but with better precise actions and more precise incisions. In the long run, this could limit jobs, which could be seen as a threat, but it is not seen that robot arms are replacing the doctor, so to say, but they are really seen to really help them and possibly cut down on the strenuous, long tasks of surgery while limiting the mistakes that are made during surgery. In a study, it was shown that the use of artificial intelligence in any fashion was proven to help increase health outcomes by 40% and reduce treatment costs by 50%, which might be directly correlated to how expensive doctors are for even an hour, thinking of insurance and all the things that fall into this category and how much you have to pay for doctor visits. And the limiting of mistakes improves diagnosis rates and increases the amount of time patient patients are in the facilities, so they're allowed to be seen in a shorter time and get better answers. As an example, like I said, radiology is the primary use of AI in medicine right now and has helped advance the field. It allows there to be help in labeling abnormal exams, identifying quick negative exams, x-rays, especially in hospitals with few human resources, which is a major issue right now. The real question surrounding the research of AI is how can human chemists and AI work together effectively? The answer to this question will allow medicine to reach new depths and grow to unthinkable places and solutions. A combination of physical and virtual aspects of AI in medicine with AI-enabled computer applications can help take notes, analyze discussions, and enter the data directly into EHR systems, which help greatly. So this healthy balance can lead to optimum results, including that dictation assistance, and this can increase productivity. These techniques have been used and have been helpful to provide insight into patients' medical needs, and it was found that the physicians in the study that used documentations support, like dictation assistants or various medical scribe services, engaged in more face-to-face time with the patients, leading to happier patients with better answers coming directly from a doctor. AI used in medicine also reduces manual labor and frees up primary care physicians to increase productivity, precision, and efficiency. The job of being a doctor is seen as one of the hardest in the world, with long hours, endless tasks, and if AI can help them in any way, it'll grow the medical field and help more solutions be found in many different ways, allowing for new cures and new depths for researches to occur that may have never even been thought of before. These changes will challenge the way we think, and will need doctors to be willing to change the way they do things now. A great line said by Ann Fisher, who is a director of defense sciences, was, "Chemists will need to change the way they think about data if AI is going to get better at searching chemical space." And that really just kind of encapsulates that AI challenges the way that doctors think, but that is needed for new depths to be reached. A great example of AI and human resources working together well was a study done by Dr. Raymond, who used AI to guide his enumeration by having it predict what compounds might be drugs and which might be successfully synthesized, which he had been working on since 2005, and AI helped speed up his studies. This would have taken years for a human to work through. Another great example of this was in Linköping University, which has been using AI to search chemical spaces for about 2 million compounds of common crystal structures. And with this, they were able to find an aluminum atom that had only been reported once before, showing that these computers are able to reach new depths and speed up experimental processes to find new things and advance chemistry and medicine as we know it today. Next, some challenges faced, like I said before, is how the findings are not shared, which kind of goes back to this piece here. So the findings remain in the hands of specialists and not chemists that can find new depths and get better knowledge from these findings. And this could play into just human nature and wanting to find like the big like bam moment, but this is really setting back science and is truly lacking how we use AI and just science as a whole. Another big challenge faced is how to properly set up AI and the outcomes we want. So, some argue that AI explorers like rovers in space should be free to search the chemical wilderness findings, but possibly this could make them more accurate, or it could just confirm some things we already know. The biggest question of all faced by chemists is if AI algorithms should learn on their own, or do they need the laws of the universe to effectively search? And I think the answer to these questions, when found, will really help us reach this healthy balance of a human chemist and artificial intelligence working together to make great new advances in the medical field. And that's just kind of this whole section here. And it's like, should there be a tight leash, and the role of algorithms can limit the findings. But that is a very hot topic right now with AI. Another major challenge for the world of science and medicine was obviously COVID-19, very recent, but this honestly increased the need and the funding for artificial intelligence and allowed it to make new leaps. This included many new field tests for artificial intelligence to be supported and new technologies tested out, such as algorithms used to monitor patients and screen COVID patients and test them, such as that. And this also helped limit patient-doctor contact and limit the spread of disease. And during this time, the funding for AI was increased, and with doctors staying home, it also allowed them to kind of just make new leaps and increase their brain power and questions on this field. The last question that might really never have an answer is, when will AI be ready? The answer changes depending on who you ask, but AI is already working in our daily lives, and I think it'll truly only grow from here and find new depths. So although the major research technology aren't ready now, there are still great new depths that have been reached, and they are getting close, and we need to just make sure to keep up with them to see great new advances in medicine and science as a whole. But it's going to take changing the way we think, sharing some of our findings, and things like that. In conclusion, artificial intelligence has a major role in healthcare and has already helped in so many ways. So when these new possibilities in research are found to work, medicine will take a new leap and become stronger and more reliable than ever. As I said before, it has improved decision making, helped in treatment, given a superior experience, which really can make a difference in hospitals, things like that, when people are already feeling down. Just having an answer can help so much. And as we see in these charts, it kind of just summarizes what I said, but all of these are just things that AI is doing currently to help ease the lives of patients and doctors, and artificial intelligence is being just used in so many different ways and will only continue to grow from here. We don't really notice all the uses of AI, like I said earlier, but it is so important for medicine and just the advancement of science to focus on finding new depths for this and to grow our drug development, which AI can really make recognizable differences versus a human who has so many things limiting them. And health monitoring, this can really just help get patients in and out of the hospital quicker. Surgical treatment, like I said, the robotic arm. And there are just so many different ways that we are seeing AI be used now that we honestly might have not even described as AI, but will allow for us to get so much farther in the medical field and just make so many great advancements. And that is how developments in artificial intelligence can bring advancements to medicine to grow and change the world as we know it.